My next question to you is about restricted or repetitive movements like hand flapping, rocking, usually called stimming, which is mostly seen in children with autism. What is the occupational therapy perspective in this regard?
Firstly, we have to understand why stimming or why the repetitive movements. Usually, like the autism spectrum disorder might spend a lot of time repeat rocking from side to side. They might repeatedly spin the wheels of a toy or a car. These are the usually set complaints of the parents. And they always want, they have a question like, how, so they are worried about this. Like, we don't want my kid to flap his hands. I don't want my kid to, he continuously does that, the spinning of the toy, or like, he's continuously on it. So, like for that, we need to first understand that why he's doing that. Unless you don't understand why stimming, okay, it's never going to go away. So the first thing is like, there are these stimming, or they are also called as the self-stimulation or the stereotypical behavior. And people with autism, they often thrive on the routine. Like, they want it continuously. They're sometimes you also see they will just go and on and off the lights, on and off the lights. These are the repetitive behaviors. Okay, so also called as, they get this self-stimulation. Now, how can, according to the OT perspective, they are seeking the sensory stimulation. So individuals who frequently engage in stereotypical movements may do so in order to cope with understimulation and aversive overstimulation. If a kid is seeking for a vestibular stimulation, okay, he needs the stimulation from the environment and he's not getting it. So he will start flapping and he's seeking for the vestibular stimulation. Okay. Whereas if the kid is understimulated, okay, again he is seeking for it. So he will again start like, he will just rock it while he's sitting still. He wants the movement. Vestibular movement is like seeking the movements, okay, from the environment and from the own body. Like they want more of movement. And this movement helps them to calm down and get more attention. Yes. So it is a kind of the stimulation that helps you to be more focused and more attentive. Usually the autistic kids, they seek a lot of vestibular stimulation. So, they love swinging. Again, it comes under understimulation and overstimulation. When there is overstimulation, they will they are sensitive to the swing. And when there is understimulation, there is more of seeking. So usually these repetitive and stereotypical behaviors are seen when there is a more of sensory seeking. Usually the questions are like, how do we stop it? First thing is like, you don't have to stop it. Yes. You have to replace it. Because when you need something, okay, you cannot stop their needs. If you try and stop their needs, there are the behaviors that will come up. Yes. Okay. So maybe, yeah, there are other sensory needs. Like, there are kids, for example, who will just start chewing, like, they'll start putting their fingers in their mouth. There are many other things that will start, you will start seeing with the sensory processing. Yes. And it's related to this. So we don't have to stop it, but we have to use an appropriate sensory stimulation so that to replace this repetitive behavior. Yes. So definitely occupational therapy helps with the sensory stimulation, and it's very important because overstimulation is not good and understimulation is not good. It should be at the level of arousal. So it's very important, the word appropriate. Yes. Usually for them to be more calmer, provide them with a more be more consistent with them, try to stick to a schedule, reward with a good behavior, look for movement breaks. This is very important. Okay. Yes. Just don't say that, no, he has to sit for 1 hour. He has to sit for 1 hour. No, you have to understand his body. His body wants movement. Okay. Yes. So if you give more movement, more results. It's not like, okay, if he's sitting for 1 hour, you are getting more productivity from him. Yes. Like this. If he's more aroused, if he's more focused, you are getting more response and productivity from him. So this is very important. And make time available for fun. It's very important. Like for them, that's an occupation, to play, to have fun. It's their occupation. So
Yes.
don't take away their occupation. Just because you want their, no, you need to understand his body, his needs, then it's going to be really easy for you. And the important is, like, if you feel that, okay, your child is not able to sit still for a long time, try
Mm-hmm.
to change the let him come from the chair to the floor, or sitting on a pillow, then sitting on a small exercise ball. Like, just don't force him, like, no, you have to. Can give him options, like, okay, now he can't sit still, because the body has this proprioceptive input as well. The proprioceptive input is like, you get this stimulate, it gives you an awareness of your body. So if there is lack of proprioception, he gets tired easily. He complains of pain in his hands,
Yes.
complains of pain in his back, not able to sit still. So taking all these things into consideration, we have to focus on this. And definitely, if we provide the kid with a sensory stimulation, appropriate sensory stimulation, all
Yes.
these things like flapping, rocking, going side to side, they will
Yes.
slowly be replaced by purposeful movement activity.
Yes.
So, and the last and the foremost thing, never say no flapping, no jumping, like no rocking. Instead,
Yes.
you have the same movement. Try to say him, okay, I think your body needs more movement. I think your body needs more of visual stimulation, more of vestibular stimulation. Okay, let's go on the ball. Let's do some bouncing. And
Yes.
every kid has different sensory needs.
Yes.
So maybe, like, your child, he is not happy bouncing on the ball, whereas the other kid, he feels like more relaxed and calm down when he sits on the ball. So you
Yes.
have to choose this, that which sensory stimulation is more beneficial for your kid. So it
Yes.
depends upon each kid, child to child. So I think that's how the stimming can be replaced.
Yes. Thank you so much for that answer, Kathy. I think it's important to know that repetitive movements or restricted movements are a result of how they are trying to self regulate themselves. So it is important that parents, professionals, caregivers, they know what is the root cause of it and how occupational therapists can provide more information. And as you mentioned, an appropriate level of stimulation so that they are not overstimulated and they are not understimulated.